Welcome, everyone, to our Wednesday night online forum, Courageous Conversations. And as you know, this is our normal Bible study night, but tonight we are taking our Bible study, turning it into Courageous Conversations, because I think we all have questions about the COVID-19 vaccine. I have personal questions about the COVID-19 vaccine. And so tonight is an opportunity, a forum for you to be able to present your concerns and to learn and to get educated and informed and empowered. As we know, the scripture says that people perish for a lack of knowledge. And so tonight, it's about sharing information, it's about sharing knowledge, and it is about engaging you, the public, so we can help you get understanding about the vaccine. You know, the truth be told, the African American community has a long and sordid history as it relates to medicine in America. And how we have been treated, and in many cases still are treated in medical communities. I mean, we can go back to the 1930s, right, with Tuskegee. In the Public Health Service, working with Tuskegee Institute, began a study to record the natural history of syphilis in hopes of justifying treatment programs for Blacks. And as we know, I don't call it the Tuskegee experiment, I call it the Tuskegee scandal, because African-American men, some 600, were duped by, the health services and supported by the government in such a way that they watched and tracked the spread of syphilis in the community. And ultimately, it did come to an end because of a whistleblower, essentially. And there was a $10 million settlement. And ultimately, we did a show on it. So we understand that many of the people that were a part of that Tuskegee scandal have still not been paid. And it was a mere $10 million for over 600 men and their families. 40, 50 years later, they finally did get an apology from President Clinton. But, that untreated syphilis experiment or scandal rocked the African-American community. But it wasn't the first time that African-Americans had been duped as it relates to the medical community. J. Marion Sims, right, who is the father of, gynecology, did his research on enslaved Black women without anesthesia. Medical ethicists, historians, and others say he used enslaved Black bodies as medical test subjects. And the reality was, of course, he damaged and hurt, dehumanized African-American women for many years. And he was a celebrated gynecologist. Of course, there's Henrietta Lacks, was a woman who unknowingly donated her cells at Hopkins in the 1950s, I believe it was. And, of course, her family was never compensated for that. And then just recently on Courageous Conversations, we did a show about the hysterectomies that were done to migrant women who were held while, for crossing the border, right? Dawn Wooten was the whistleblower who shared that information, and she filed a suit in regards to how the migrant women were being handled. And so we realized that there is a long sordid history. And so we want to just be, full disclosure. We realize that, and we know the impacts even today of how African-Americans are treated differently many a times, not all the time, but many a times in our medical settings this day. COVID-19 is affecting the Black community at an alarming rate. A recent report from the Brookings Institute talks about the death rates of African-Americans between the ages of 55 and 64 are higher than that of white Americans age 65 to 74. And death rates are higher for Blacks age 65 to 74 than for whites age 75 to 84. And so on. In every category, Black people are dying from COVID at roughly the same rate as white people more than a decade older than them. Age-specific death rates for Hispanics and Latino people fall in between. The disparities can be observed at all ages, but are especially marked in somewhat younger age group. These disparities can be seen more clearly by comparing the ratio of death rates among Black and Hispanic Latino people to the rate for white people in each category. Among those aged 45 to 54, for example, Black and Hispanic Latino death rates are at least 6 times higher than those for whites. So we have a lot of questions. There needs to be some work in this area. And tonight, we're so blessed to have three professionals with us to be able to answer those questions. Dr. Idahosa is an adjunct professor at Temple University and an attending physician of critical care at St. Luke's. In the St. Luke's Critical Care and Pulmonary Associates, he is board certified and also board certified by the American Board of Internal Medicine. Dr. Shelly Blake is a doctoral student at Howard University, the Howard University. She's a registered pharmacist and actually works right here in our own community at the Walgreens in Easton, Pennsylvania. She's a consultant pharmacist in long-term care. Nishe Clark is the president and founder of NVC Consulting LLC, predominantly serving the healthcare space for almost 20 years, including large pharmaceutical companies like Pfizer, one of the COVID vaccine manufacturers. She was recently hired by St. Luke's Hospital Network to assist in bridging healthcare disparities in COVID-19 vaccine uptake, specifically helping to provide a different point of view for Black and Brown individuals struggling with vaccination, with the vaccination decision. Wow, thank you all for taking the time to join us tonight. We're hoping for a very robust conversation where we can speak openly about the issues that are plaguing our community. So Doc, I want to start with you. As a critical care physician, you were on the front lines. What was that like? How did that affect you? And did it cause you to want to get vaccinated?
Yeah, thank you, Pastor Phil, and thank you, the Greater Shiloh Church, for setting this up and getting people together to talk about this very, very important conversation. I totally agree 100% with you, all the data you quoted, and you could see where the hesitancy is coming about, with this vaccine. Over here in St. Luke's, I work in the critical care unit, and I basically take care of COVID-19 patients in the intensive care unit. Mm-hmm. It's been a trying experience, I will have to say. It's been challenging, it's been tough. They're really, really very sick patients. Mm-hmm. And COVID-19 is a humbling experience. It humbles you. You see people that shouldn't be dying. And not only dying, they die in a very lonely manner, because patients can't see their families, yes, because of all the restrictions and everything. So that's been trying for me. It's been trying for the staff. It's been a tough experience, So, it was easy for me to get around all the hesitancy out there. Yeah. Saying, I'm going to take this vaccine, because I see the impact of COVID-19 every day. Mm-hmm. I see the impact. COVID-19 is a bad, bad disease. You can't play with it. People die from it, So I got my vaccine a few weeks ago. I got the first dose, and I subsequently, 21 days later, I got the second dose. Mm-hmm. After the first dose, I had a little bit of soreness in my left arm.
So I was going to ask you about your experience. Yeah.
That resolved with a little bit of Tylenol, and I felt a little fatigued, but that went by within a day. Mm-hmm. And after the second dose, I really didn't feel anything. Really, I thought I was going to feel a lot after the second dose, but surprisingly, I didn't feel anything, right. And I did okay with it.
Wonderful, thank you. Now, Nishe, you work with St. Luke's, and is there? Are you seeing African Americans that work there, or from your experience, wanting to take the vaccine, and how is that working out?
Well, I think there's two things at issue. There are certainly a lot of healthcare professionals, like Dr. Idahosa, who understand why it's so important to get this vaccine, who see what's happening to patients every day. Mm-hmm. And then there are those individuals, Black and Brown individuals, who are thinking about what you were talking about it when we started. They're thinking about Henrietta Lacks. They're thinking about Tuskegee. They're worried about whether or not, they're being killed or injured by others. And what I want to articulate to those people is look at what those scenarios have in common. Two things. They injured Black Americans and there were no white Americans involved.
Right, right.
That's very different than what's happening with this vaccine.
Mm.
White Americans are jumping each other in line. They are fighting for their place.
Right.
They are, quite frankly, in some cases, conniving and conspiring to jump the line in order to get the vaccine.
Sure.
So when I think, just in general, if I see a crowd of white individuals fighting for a product, my first inclination is not to think that that product was meant to kill me. My first inclination is to think, well, I probably should try and get that. Right. And in this case in particular, it's really about social justice because so many Black and brown individuals are the frontline workers. Right. And so we have to follow the money and the motivation. Why is the vaccine out there? Quite frankly, because Pfizer, Moderna, Johnson & Johnson down the road, all these pharmaceutical companies want to make money. There is profit to it. And there is a pandemic that is not just affecting us. So they are saving their own lives. We need to get a part of that. That's and not be left out.
That's a wonderful answer. And thank you for that. And I like that you drew the disparity, right? So before there were not white individuals involved, right, in Tuskegee or Henrietta Lacks or, what was going on with Marion Sims, but now, right, they are engaged and we can watch their participation rates going off the charts. So there's a myth out there, and I'm going to ask Shelly, I'm going to ask Dr. Shelly, I'm going to ask you, I'm going to keep calling you Dr. Shelly because it really sounds good on you. But let me just ask from a pharmacist perspective, are there two separate vaccines, one for Black folks and one for white folks?
No.
Okay.
No, the vaccine is, again, available only and the only difference is depending on where you go and what they have available, that's what you're going to get, but there's no difference.
Okay. Well, that's really important because, that's one of the myths that are floating around out there. When the African Americans get in line, and even if they're behind a white person, they reach behind the counter and get the other drug, right? And they're injecting African Americans, but I think Nishe really helped us with that. And so, Dr. Osa, if I can ask you, what are the recommended vaccines presently? And how do they actually work? Just so people can maybe get an understanding.
That's a very good question. Right now, the two vaccines that are approved by the FDA are the ones made by Moderna as well as Pfizer. The J&J vaccine is coming up, and the AstraZeneca, those ones are still being, researched and stuff, and hopefully those will be approved in very soon. The Moderna and the Pfizer vaccines, they are it's a new technology. I give you that. They are what we call mRNA vaccines. Okay. Basically, the vaccine supports healthy cells to produce viral proteins to stimulate a potent immune response. So the way to look at this is the coronavirus on itself, it has like 29 proteins surrounding it. There's one particular protein called the spike protein. So what scientists have done, they take the genetic sequence for that spike protein, the mRNA sequence, and they put that with a lipid formulation and then make a vaccine out of that. Basically, they inject that into your body, and your body is able to recognize it and form proteins similar to the spike proteins, and they stimulate some other cells in your body that produces antibodies. These are the antibodies that we come around and fight the virus for you. So it's a beautiful technology. All of us in the medical community, we are all like pleased with it and happy about it and all that and stuff. And just to say one last thing, absolutely not. They are not two different vaccines for Black and white folks. It's the same vaccine.
Sure. And thank you for clearing that up. I think it's important to hear it and to hear it from people from the Black and brown community, because a lot of times we're receiving information, but we're not receiving information from professionals, who actually look like us. Nishe, let me ask you a question. When you think about the vaccine, I'll just be real straight. Do you trust the vaccine? Do you think that taking the vaccine right now is risky?
It's not about trust.
Mm.
I'm not sure whether I trust the vaccine or not. But what I do trust is my understanding of capitalism and human motivation.
Right.
We live in a capitalist society. People are looking to make revenue.
Right.
I have consulted on numerous occasions for Pfizer in particular, and I'm telling you right now, you can barely turn around and staple a sheet of paper without an attorney coming up behind you and asking you to check how you're doing.
Sure.
They are very risk averse. There is so little tolerance for risk at many of these pharmaceutical companies because they don't want to be sued. And these types of lawsuits are what take companies out. So I trust that they are doing everything humanly possible to prevent themselves from risk exposure. And I also look at motivation. So, people are motivated to end this pandemic and to move forward. And when I look at white America's motivation for that in particular and see how they are following through with the vaccine, to me, I think, let me get in that line and let's see if I can move up in my place wherever my place belongs to be and certainly not be left behind. So I think that you look at risk and benefits. There is more benefit to taking the vaccine at this point, in my opinion, than there is risk.
Yeah, I mean, that speaks to a true reality, right? And here's what we know from a Christian perspective: money's not bad, but it's the love of money that is the root of all evil. And so, if this is being driven by finances, could it be said that they moved through this process so quickly that they did not have time? And this is to any of you, that they did not have time to truly understand what the long-term effects of a vaccine such as this could be.
There's always risk, but one of the things that so many people don't understand, they keep looking at these vaccines as new. The coronavirus has been with us for decades, for millennia. It is the common cold. We have been developing flu vaccines for decades. The technology has been there for quite some time. There is not a lot of money in pharma for curing someone. There's a lot of money in disease treatment, and in this case, in disease prevention. So, we probably could have cured a lot of things already if the money was right. In this case, the money was right for the vaccination. And so for me, when I look at it and having worked with these companies and knowing the science as well as the risk aversion, I don't see a lot of risk with the timelines, because while this is a new vaccine specific to COVID-19, they are building it off the platform of dozens of other vaccines. Every year they have to make a brand new flu vaccine. People don't think that the flu vaccine is pretty much brand new every year. They're looking at what different variation of the flu virus, of the flu is coming out that year. And you have to start from almost the same base level as where they started with the coronavirus. So, that's where we get a little wonky and into the science, but that is in fact the truth of that aspect. So, I think there's a lot of concern, quite frankly, because the vaccine came out during the Trump era. And for some of us, many of us, that puts us in a certain kind of way. But again, it's not a Trump vaccine. This was Pfizer and Moderna's and soon J&J and then AZ's vaccines, who have been there long before and long after, and they're worried about their bottom line, and the lawyers are keeping things right.
Thank you. That's a very thorough answer. Dr. Shelly, as a pharmacist, did you see people coming into your pharmacy who were either infected or seeking some type of relief from the symptoms, on the symptomology and the impact of COVID? And how did you direct them? Because I had a person in the family who we thought had COVID, and I was at a loss for what to give them, right, to help them through that process, because they were suffering from some very strong symptoms. How did you direct individuals, and what was your interaction like?
Well, the initial conversation I would have was, of course, to check and ask if they've had fever. Did they feel any loss of taste, any body aches? Because again, the flu is there's still 17,000 people a year roughly that we lose from the flu virus. So everyone assumed initially that this has got to be COVID, but they're still forgetting that flu still kills. So I think a lot of the population immediately came into the pharmacy with the idea that these symptoms are related to COVID.
Right.
But in the early stages of it, before hearing, some of the recommendations that we were given to give patients, everyone just went immediately to Tylenols or to your anti-inflammatories. And later on, we decided to kind of incorporate what we saw a lot of the physicians recommending. And that was things like vitamin D and vitamin C and zinc, and adding that on to also adding on things like melatonin, because of course, as you sleep, your body generates more cells. So that was part of the regimen and part of the recommendations I would give, but predominantly most of the symptoms were pretty much what you would get with the flu. So it was a little hard to kind of determine just on, standing there and looking at a patient or a customer and saying, you have COVID. So you never would discuss it as COVID. It would be more like flu symptoms, which was one of the stated reasons as to, stated symptoms that people would experience if they were to get COVID. It was more like flu symptoms. So, I would have to ask patients, did you ever get your flu shot? And most of the time when it was African Americans, it was no.
Okay. And so before I get to the questions that are coming in from our community, have you, Dr. Shelly, as a pharmacist, considered getting vaccinated? And if you don't mind answering one way or another, where are you?
Yes, I definitely have. This is the phase that I wanted to kind of watch and wait and see. And this is my reason why. And it's very personal for me. But I wanted to see with this, because we have 3 phases before it usually hits the market, right? So this is the area where it's the largest population that we'll see. So patients who have certain comorbidities, which are not going to be part of your control studies, I wanted to kind of see if that would be something that would affect me. I have a blood dysplasia or sickle cell. So I wanted to see if any way I would hear or know of something that took place, but I'm in line for my shot. So yeah, it's just a matter of my clinic, more my next availability. It comes down to me at where I work to get it done. But at no point in time was I thinking not to get it. I just wanted to see if I heard anything initially, and then I had no problems with getting it. There was never any doubt about it. Plus, we have to remember Kizzmekia Corbett, that's the PhD who's the viral immunologist, African American woman. She's the scientific lead of the vaccine.
Yeah. And so I mentioned that to some African Americans, and they were like, yeah, they just put her out there because, you know how our folks are. Sometimes we can ride out a conspiracy theory when it supports our point. But yes, I did some research on her. She's pretty amazing. And for her to, champion this process says so much about her capacity as an academician and as a professional. Did you want to say something, Nishe?
I actually want to challenge a little bit the conspiracy theory, because I think, to your point, we are so good at coming off with these conspiracy theories.
Yes.
But one of the things we have to remember is when you say to most people that the leading investigator was an African American woman, they're not aware of it.
Right, absolutely.
So, typically in something like this, their picture would be already on the cover of Time magazine for Person of the Year.
Absolutely.
So she is an unregaled hero right now. Absolutely. And so there is no conspiracy along those lines, because they haven't trotted her out. I think it's actually a shame how little she has been broadcast and put out there.
Absolutely. I think that's an effect of colonialism, right? And the work that has been done on us and our psyche, that when one of our people rise to the highest level of academia and, produce these wonderful outcomes, there is something inherently in us that sees something crooked in it. It just doesn't make sense, but it is a reality in which we live. And so, thank you, Dr. Shelly, for bringing up that information and sharing with us. for our audience, our viewing audience, she was an African and still is an African American who discovered that. Dr. Osa, I want to ask you a question, and it's in the chat. It says, my question is, why are people still testing positive for COVID-19 weeks after receiving the vaccine? Does this mean that they could still be an active carrier for others to contract it? Or is it just lying dormant in their system and are not contagious? Example that is given, COVID-19 be similar to Lyme disease, whereas when you contract Lyme disease and are tested at different times, you will continue to test positive, but the disease is not active in your system at the time to cause issues. So Doc, I'll put that question to you.
Say the question again, if you don't mind, the first part of the question.
Yes, sir. Mm-hmm. Is how can someone who has had the COVID vaccine still test positive?
Okay. Mm-hmm. So basically, like if you look at the data, the important thing with all these things going on is that, people don't trust the evidence anymore. So in the scientific community, thank God we have a new government and everything. And It looks like with the new government, the docs are in charge now, and we are going back to evidence-based medicine.
Science again,
so
yeah.
If you look at the evidence, the data from the Pfizer vaccine as well as the Moderna vaccine, 95% of people, it has 95% efficacy. Right. So, but that comes about from like 10 to 14 days after the second dose. If you take the first shot and you feel sick after a while and you test positive, you'll be positive. But presumably, after the second shot, after 10 to 14 days after the second shot, you're protected up to like 95%. So is it possible that you could still be positive? Of course it's positive. But when you look at that data, really, they were looking at, do you get sick from COVID? Do you get severely ill from COVID for some part of it? And a large majority of people among the people that got the vaccine did not fall ill from COVID. Right. A few people that fell ill, yes, in the Pfizer data, about 8 people still got positive from, got sick from COVID. So my point is, we don't know exactly if you still test positive for the coronavirus and stuff, but when you look at everything, you have the antibodies. Even if you catch the virus, the antibodies can work on it. And even in the last 24, 48 hours, we're getting some new data from the AstraZeneca folks in London. And what they are saying is that they are not seeing transmission of the virus after getting the vaccine. That means fewer people will test positive for the virus. So there'll be less transmission, of the virus. So the question is, could you still test positive? Of course, but very few people are going to test positive. That's what I think.
Very good. Thank you for that, Doc. And so, Nishe, I have a question for you. Working, on both sides, in the medical facility and with the pharmaceutical companies, it is stated in a few reports that probably around 10% of African Americans were involved in the trials. What does that? How does that play out, and how does that affect the information and data set that they're utilizing to, analyze?
To be honest, it's both encouraging and disappointing.
Okay.
That number is encouraging from the standpoint of when you look comparatively at many other clinical trials, especially clinical trials in disease states that disproportionately affect us, we are either not there at all or in very small numbers. I give the example of prostate cancer, which very much disproportionately affects Black men. There is a drug on the market that had 0 Black men in their clinical trial, which to me is, again, I look honestly to both the fault of the pharmaceutical company and to our community, because we are taking ourselves out of the equation because of our fear. And that fear is actually helping to keep us pinned down. As well as the pharmaceutical companies for, quite frankly, not doing enough. And that was actually part of the work I did with Pfizer. Ironically, Dr. Shelly, working on one of their sickle cell drugs. trying to help them better understand how to work with and tap into the Black community and to gain their trust and their partnership. So I think that it's important that we participated. I do think that at least that 10% helps to demonstrate that there is no differential racially with the vaccine and the disease state. But I do wish we participate more because it's in our best interest and it can save our lives.
That's pretty amazing. When you think about 10% being a good number, in many things, that's not something that you would consider a good number, but to say that that is up from some other trials, it means that, you know, some people saw it as valuable to participate and engage in that space. Dr. Osa, did you want to share something in regard?
I totally agree 100% with Nishe on what she just said. I just have one more thing. Yes, it is 10% of people, but do you know the number of people that got the Pfizer vaccine? That 10% of African Americans, do you know the number of people that got COVID afterwards? 0.
Wow.
So that's awesome. That yes, it was just 10%, but we could determine that it was efficacious in our people. And
unlike right now, and no deaths. And what are we facing right now in the Black and brown communities? Disproportionate deaths from COVID-19, which is why, again, I look at the risk benefit analysis. So far, I'm seeing no deaths with the vaccine and a whole community that is being gripped from mortality from the COVID-19 virus.
I tell you, this information is it's revolutionary for us, and we don't have forums like this enough to share. So Dr. Shelly, I'm going to come back to you. So there's a question in the chat, and if you don't know the answer, it's fine. But is it true if you had Bell's palsy, you should not get the Pfizer vaccine? Are you aware of that at all?
Not true.
That's not a myth, right?
Yes.
Somebody's probably in the barbershop and was like, "Oh, I have Bell's palsy. You know, they told me not to take it." Right?
No, there's no literature or data to say that there's anything related to Bell's palsy. You know, similar to some of the people feeling that certain vaccines would cause things like autism. But when you do get the tests or the studies, it's not there. So you're right, a lot of misnomers.
There are no peer-reviewed empirical data that supports that,
No.
you know, those statements, but a lot of times it's just misinformation passed from one person to another. So that would include Bell's palsy and cerebral palsy. Is that correct?
And cerebral palsy, yep.
Okay, cerebral, thank you so much. So this is to Dr. Osa. What should I do if I don't trust medical professionals due to history?
Well, you know, and I'm glad this is a church group. You know, the Bible says, "You shall know the truth, and the truth shall set you free."
Yes, sir.
You know, so I believe that what we can do as medical professionals is to tell you the truth. You know, know the evidence, know the truth, and the truth is these vaccines have been studied. You know, and our people were represented in those studies. If the vaccine has been shown to be efficacious. And, you know, our job is to let people know what exactly is going on. You know, what exactly is going on is this virus disproportionately affects Black and brown people. Just the same thing you've said, you know, how do we stem this tide? How do we help our businesses? How do we get our children back to school? The only way to do this is to get vaccinated so that we can develop what we call herd immunity. If we develop herd immunity, at some point, this transmission of this virus from one person to the other, that is this virus that is decimating our families and decimating our lives, we can nip it in the bud. If we don't do that, we'll still be suffering. And that's the truth.
That is so true. Thank you, Nishe. To you, what do I do if I don't trust the medical professionals due to history?
I mean, I still go back to let's not focus about trust because everyone has different hurdles for trust. Okay. You know, some people trust, you know, when they initially meet someone, some people, you know, they never are able to trust someone. What I look at is risk benefits and I follow the money. And right now there is greater benefit to taking the vaccine than risk. We've talked about that in several different, from several different points of view. And there is no financial reward for these companies to put out a vaccine that is not appropriate and that is not efficacious. And I know someone, asked the question again about the speed. And I say again, first off, it actually was not as fast as you might think, because it came from a foundation of other vaccine platforms. And you would be surprised how money and great need can motivate companies to work at a faster pace. Whereas when they're just doing things experimentally and don't know if there's revenue at the end of the cycle, sometimes they just take their time.
Or chase the money, right? So I'm going to come back to you, Dr. Shelly. I know you are a student at the Howard University, working on your doctorate degree. Let me ask you a question. Do you know what is in the vaccines, or have some ideas of, what the contents are of the vaccine?
Yes, I mean, other than the active ingredient itself, they just kind of mentioned things like binders and stabilizers. And I did have some information on what's actually in the vaccine, but there was nothing that was, how can I say, specific as to what is causing the vaccine to be a COVID-19 vaccine. It's not revealed in layman's term, but there was nothing outside of what you would normally find in your regular travel vaccines or immunizations. Nothing that stood out different. Preservatives were there, like it is in your other vaccines as well.
Sure. Dr. Osa, what about you? Was there any concerns when you were studying the contents of the vaccine?
No, I mean, it's pretty simple. Like the vaccines that have been approved so far, they are mRNA vaccines. They're made in lipid formulations, and which is something that, we do with other medicines, and so it's just nothing like extraneous in the vaccines, so.
Because we've heard everything. Yeah, we've heard everything from,
microchips.
Yeah. Okay. Thank you. Right. Because there it is. I was trying not to go there, but thank you, Doc, for taking us there. Yeah, we've heard that it's a conspiracy for the 1% to take over the world and do population, elimination, genocide in the African community, African American community. Bill Gates is behind it all. So it's just important to have kind of open forums like this that can allow us to speak truth. So a question, if you had COVID-19, do you still need the vaccine, or would the virus make a person immune?
So the current recommendation is you can get the vaccine 90 days after you've had an infection. Okay. And it's important we buttress this, especially with the advent of the new variants that we'll be hearing about, like the South African variant and the British variant, the Brazilian variant. It's important that we still get the vaccine, because the antibodies you would have developed after getting the infection is not going to protect you against those variants. Right. So the CDC currently recommends that 90 days after you test positive for COVID, you should get a vaccine. And it's very important we do that.
Yes. Thank you for that. So the next question is, why are children left behind from receiving the vaccine? And isn't it of great importance for children to normally receive vaccines? I'm going to continue on. I'm happy you all are giving this information. My son has been diagnosed with COVID today. His symptoms are not bad yet. Should he start the vitamins now before the symptoms start? Doc, I assume that would be a question for you, but I'm sure all of our panelists can give feedback.
Yeah, so it's a very important question. It's a very good question, actually. I'm trying to remember the first part of the question.
Why are children being left behind?
Oh, yeah. So children, the data for the children is being developed right now as we speak. So we don't have enough data yet on children. So that's why, like the Pfizer vaccine was 16 years and above they studied. And I think the Moderna was about 18 years and above. So they're still studying the impact of the vaccine on children. At
Right.
some point, we'll get that data, and then they start giving children vaccines and stuff. For the second part, I'm glad that his child is not too symptomatic, so that's good. I think as in most viral infections, the main thing is isolate yourself, make sure you're well hydrated, watch your breathing and all that. Certainly if your symptoms get worse, you need to go to the hospital. One other thing is that we have what we call monoclonal antibodies right now that we give in select centers in the St. Luke's network. So and it's mainly for people that are older, people that have underlying medical problems and stuff. So before you get very sick, you can go through your primary care doctor, and if they say a set criteria, if you fall within that criteria, you can get the monoclonal antibodies. It's an IV shot, and has shown some efficacy in the early part of the disease.
Thank you. So the last part of that question, we got like 11 questions left in the thing. So the question is, should he start vitamins now before the symptoms start? He was just diagnosed today.
Oh, he was diagnosed and he doesn't have symptoms?
The symptoms are not bad yet. He's got some. But
I personally don't have anything against vitamins. I think vitamins are good things.
Okay.
But just so you know, there's no strong data saying that vitamins will prevent progression, but feel free, take vitamins, is good.
Nishe, what is the difference in a vaccine being FDA approved versus the vaccine being approved for emergency use because of the pandemic? What blood types have you heard are possibly immune, and is this just talk, or is there any truth to it? So it's a two-part question. I can break it
bottom up. Yes, just talk. Like the microchips and Bell's palsy and all the other things. There's no data that demonstrates that, particular blood types are immune or more likely to be infected by COVID-19. So I use that to say it's important to be vaccinated, and it's also important to have all the information and to get it from the right sources. In terms of FDA approval, it's important to understand that it is all basically the same thing in many ways. The FDA is the one who provided the emergency use authorization. That basically just meant that there was a certain speed. I'm working on 3 drugs right now that are going through FDA approval. The level of, just quite frankly, paperwork, we put about 9 to 12 months in our on our launch calendars just to get through all of the launch paperwork with the FDA. It often takes 3 to 4 months just to get on the calendar for those meetings. So basically what happened is, instead of Pfizer and Moderna having to wait 4 months to get on the calendar, they were granted an emergency meeting. The second they had their data, they didn't have to put it into 22 different, technical mechanisms. They could come in and show the data. So, and then the FDA approved it for use. So there is not really much difference other than a lot less paperwork.
Yeah, I'm going to say I didn't agree with a lot of the things that our prior president did, but that I thought was to be lauded and celebrated for helping to fast track that process. Dr. Shelly, I want to ask you a question. Which tests are more accurate, the rapid test or the nasal swab?
The more accurate test would be the rapid test, but the nasal swab is right there. I mean, it's not even, how can I say, for instance, like Moderna with the percentage of it being a 94 and Pfizer being a 95, the difference is very slight. So you're not going to, lose out by getting either one of the tests.
Wow. Okay.
Yeah.
So either way, right? The tests are the tests. So the next question is, how would the vaccine affect people with severe allergies? Doc, I'll go to you on this one, Dr. Osa.
Yeah, so that's a very important question. We did, when they first gave the vaccines out, we did see some instances in England where people with allergies and stuff, severe allergies, had some allergic reaction to it, and they had to be given R.P.H. So I think what we recommend right now, what the CDC actually recommends is that people with severe allergies should hold off on getting the vaccine. And even in St. Luke's network, when we give people the vaccine, we all wait in a room for like 15 minutes, just to make sure there's no immediate allergic reaction and stuff. You have to determine how bad your allergic reaction is and to what. And and personally, I would say you have to talk to your physician to help decipher if you should go ahead and take the vaccine or not.
Yeah. So this next question, Nishe, I think you answered this already, right? Because I'm just skeptical on how fast they came up with the vaccine. And I think you answered the question, how did it happen so fast? It was fast tracked. The paperwork was definitely mitigated. They were moved to the top so that it could move quicker through the process. So I'll go ahead and pass by that because you answered that. Go ahead, Doc, you haven't answered that?
The only other thing, and people should understand this, a lot of the speed also is the advancement of technology. So that sequence, that viral genomic sequence on the coronavirus itself, before it used to take a long time to get it. But now with the advent of technology, we're able to get that sequencing very fast. The other thing too that helped the speed was that we're in the middle of a pandemic. So we're able to get a lot of patients together, like in the Pfizer trial, there were 44,000 people. They got that within months. Before you do a study, it takes a long time to get 44,000 people, but they got 44,000 people within 3 months. Wow. And during the pandemic, so a lot of people are getting infected. So you're going to get the result fast. So all these things contributed to getting fast results. And there wasn't anything out of ordinary. It's just where we are right now.
Wonderful. Thank you so much. I can't believe we've got 12 minutes left. So I'm gonna move through these questions and be as succinct as possible, but provide the information. And if we don't get to all of the questions, we'll find a way to revisit them and maybe put them up on our website. What is the correlation between vitamin D deficiency and those that suffer from the COVID-19? And there's the second part of that question. What about the mutations? Will the vaccine still work after the virus mutates? I think that's a better question. So why don't we focus there? And if you have lung disease, should you take the vaccine? Will women have fertility issues down the road? So mutations, will the vaccine work after it mutates? And if you have lung disease, should you take the vaccine?
Certainly, if you have lung disease, you should take the vaccine, 100%.
Right.
Because you don't want to be sick with COVID, because if you get sick with COVID, you're going to be very ill.
Going to attack the weakness.
The mutations, it's a little bit suspect, but one of the things that we should know is that, like the J&J vaccine that is just coming up, it was about 50-something% effective in South Africa. And yes. South Africa is where the variant is right now thriving. So it was still effective. And the Moderna as well as the Pfizer, the companies have come and said, oh, they've looked at the mutants in the test tube and stuff, and they think that the vaccine is going to be good with the variants. But one of the important things you have to know in all this, when we talk of all these variants, is the only way this virus can make variants and mutants and for the virus to mutate is if the virus infects you and is replicating. How do you prevent that? Is by getting vaccinated. Wow. So if you get vaccinated, the virus does not replicate, then it's not going to form a variant. Is that clear? So yes. That's very important for people to know, but certainly we'll have to see, we'll have to see if the mutants become a problem down the road. But right now, the way to prevent those mutants is everybody getting a shot in the arm. I forgot the first part of the question.
Thank you. Well, no, it's okay. I think you've answered the question, because this is another myth that women will have fertility issues if they take the vaccine. We know
there's no evidence to show that right now. And one of the things, just for people to know, just if I can just take 1 second to do this. So most of the vaccines over the years, the complications that's going to arise most times occur between the first 30 to 45 days. And that's why the FDA told the companies that they have to bring data for at least 60 days and above. so that if the complications are going to arise, we're going to see them within the first 30 to 45 days. Like if you look at the science of vaccinology, that's all we found over the years.
Wonderful, wonderful. Thank you so much. And I think I know the answer to this question. If a person has lost their sense of smell and taste senses in March and still haven't regained those senses, what can the patients take or do? Is this going to have to be an annual vaccine as the flu? So Shay, I want to come to you, Nishe. If somebody lost their sense of smell and taste in March of last year and they still haven't gotten it back, what should they do?
I mean, certainly I think that they should, see a doctor. I know people that that has happened to them. And most of them, it has come back over time and to different degrees. But I certainly think that, you can seek medical attention for that. And in terms of this vaccine becoming something annual, I do think that somewhat remains to be seen. Coronaviruses have been with us for so long, just like the flu, just like influenza. When influenza became, as it was more deadly, we had vaccines for it. But every year they remake the flu vaccine. You are not getting the same flu vaccine in 2018 as you did in 2019 and 2020, which again, to me, speaks to how quickly companies can understand the variants and the mutations, et cetera, and move to manage them. I worked on several flu vaccines, and that speed was quite breathtaking. So to me, it's even more reason to get your COVID-19 vaccination, be in the records, make sure that you have already had it, so that if we do need to start doing this more annually, you're ready.
Well, let me ask you this next question is, why has there been so much money put into COVID-19 vaccine when cancer and other issues have killed African-American people in America throughout the diaspora at alarming rates, multiple times the rate of death rates compared to COVID-19? What makes this money medical investment more important than all other issues that have killed more Black people in particular?
Because we're in a pandemic, and because hundreds of thousands of Americans and millions of global citizens are dying. Yes. And that is the differential. Unfortunately, there is an emergency. Unfortunately, in many cases, cancer is not an emergency. I do a lot of work with sickle cell. I'm very passionate about that community. And it has been only within the past few years that they have gotten the attention that they deserve. And quite frankly, that is part of why I'm so passionate about the healthcare disparity work that I do, and why I'm so passionate about trying to get people to take part and receive the vaccine, because while it was not meant to save us, it is the thing that will. Right. So do not allow someone to take your place that you so rightfully deserve, and take the vaccine ahead of you.
That's good. Thank you. Thank you so much. Dr. Shelly, as a pharmacist, it looks like the government is going to be partnering with pharmacies. I just heard a report that there's going to be over 1 million, doses shipped out to pharmacies here in the very near future. How will people connect to find out how they can get those shots, those COVID shots, if they're interested in doing so?
Right now, we haven't gotten any, how can I say, from our regional managers, any go ahead on when we can open up our doors to that, because it's once it becomes available to the general population. Right now, we're still focused on the high risk patients. Once that takes place, then yes, it would be, advertised. It would definitely be made available to everyone, but we're not at that phase yet. So once we get to that phase, it would definitely be made available like most vaccines are. And I'm not sure if everyone knows what is available at a pharmacy, but I'm quite sure with the media and with the information that's out there now, it would definitely be made, you would be made aware as to, your local pharmacies now have the vaccine, because they won't give us pretty much a date. I was giving a month's time, but, I don't want to speak too soon, but they were saying that it would be fairly shortly, soon, that they feel it would be available to the general public.
Okay, so here's what I'm going to do. We've got 5 minutes left. Nishe, I'm going to ask you to just answer the question. Number one, were you vaccinated? And two, why did St. Luke's reach out to you? And what do you hope to accomplish by your work at St. Luke's?
I am not vaccinated. I am desperate to get my vaccination. I have received notice because lung disease does run in my family, and I have moderate to severe asthma that I now officially eligible. Haven't been able to get an appointment, and quite frankly, as part of my, my agreement with St. Luke's, they will vaccinate me.
Okay.
So, and that was important for me to let them know that if I'm going to come and do this work, I too want to be protected, and I'm eligible, so at least I'm not taking anyone else's place.
Right.
And part of, I think, why St. Luke's and it was several physicians, actually, several Black and brown physicians that recommended me to the executive leadership at St. Luke's because they were frustrated by the misinformation. They were frustrated by seeing their colleagues not take the vaccine. Quite frankly, some of them were unsure of the vaccine themselves because they were thinking about it just from the science and at the end of the day, doctors are people too. And I had a call with them and I talked to them about the money. And they all said, got it. That makes sense to me now. And why I'm not worried about them coming to kill me. We need to start thinking about this as the iPhone. That, when the iPhone was launched, you saw white Americans lining up, camping out, in front of Apple stores 4 days in advance to get it. Did any Black person say, I really don't want that? No, we all have an iPhone now. I've got 2 sitting on my desk. So this is a coveted item, and St. Luke's is responsible for a very large community. And they understand that it is to both their business advantage as well as to their reputation, and quite frankly, to the government mandate that they need to see the entire community vaccinated. And if we don't participate, they have failed. And if we don't participate, then quite frankly, I feel like I have failed, because I want to make sure that we understand that this too is for us and we need to protect ourselves.
Thank you so much. Dr. Osa, what do you want to say? We got 2 minutes. What parting thought would you leave with our
I just want people to know that this disease disproportionately affects Black and brown people, because we are the ones on the front lines. We are the ones, sticking together in buses and in trains and all that and stuff. Let's take the chance and get vaccinated. Let's move forward. Let's help our community. Let's reduce the spread of this virus so that we can get our lives back. That's very important. And thank you for saying.
Well, let me just say, this has been just rich, and the information shared was honest, and I believe it's trustworthy. And so to all of our viewing audience, if we didn't get to your question, please shoot us an email and to the information that you all know how to contact us, and we'll make sure to respond, because I think it's important that you get your questions answered. I hope that you've been informed, educated, inspired, empowered to make a decision as it relates to getting vaccinated. You'll be hearing more from me as serving as a senior pastor here at the church on my stance and just providing you more relevant information. Dr. Shelly, Dr. Osa, Nishe, Clark, we thank you for taking the time to participate in this conversation. It will continue to stay up on our YouTube page. So if you need to go back and check any information, you can just go to the Greater Shiloh YouTube page, and we're hopeful that it will be shared through the St. Luke's Network as well, as an opportunity to inform and inspire our community. Listen, God bless you all. May God's grace cover you and keep you safe. And may the Lord continue to shine upon you and give you peace in Jesus' name. Thank you all for being with us. And thank you once again to our guests. Have a good night. God bless.